This is Julian. I'm one of the owners of Overtime Men's Health. Today I am with Carla, our lead nurse practitioner, and we're going to be teaching you exactly how to reconstitute your peptides. You should have a few materials on things that were just sent out to you. The first one being bacteriostatic water. This is going to be the water that you actually mix into the peptide to make sure that you can inject it safely. Next is going to be the peptide itself. It's going to come in a little vial like this, and it's going to be in a powder format. The powder format is to make sure that it lasts long and before it spoils, before it gets to your house, because once you mix it with the water, it's got to go directly into the fridge to stay good. Next, you're going to have your alcohol pads. This is going to be what you're using to sterilize everything. The actual needle itself, these are going to be insulin syringes. They go up to 100 units or 1 ml. And then lastly, you're going to have your draw needle. This is how you're going to actually mix the water with the peptide to get the desired dosing. For purposes today, we're going to be mixing 3 mLs of bacteriostatic water into the peptide sermorelin. So the first thing you're going to want to do is grab your alcohol pad and sterilize everything. Swab in a circular motion on the tops of the tubes of the bacteriostatic water, and you're going to do the same exact thing with the actual peptide itself. Next, you're going to grab your draw syringe and draw needle and attach them together.
The amount of water that you're going to add to the peptide can vary based on the peptide that you get.
You're going to grab these two right here and attach them. Uncap the syringe, turn your bacteriostatic water upside down, plunge the amount of air that you're going to be pulling out from the water. So for purposes of this, we're mixing 3 mLs into the peptide vial. So we're going to go draw up to the 3 ml on the syringe, and you're going to plunge exactly that amount of air into this vial. And that'll make it so that when you're pulling out, it comes out a lot easier. You see how it comes out all by itself. So now that we've drawn up to 3 mLs here on this syringe, because we've already sterilized the peptide vial, we're going to go and plunge this needle inside the vial.
It's important with the peptide that you allow the water to flow into the peptide vial without forcing the bacteriostatic water into there. You don't want to shake the peptide after. You want to either swirl it or gently roll it between your hands to allow it to mix.
And now you've got your vial of the mixed peptide. As soon as you mix this and do your first injection, this must go in the fridge. Now the reason why we used 3 mLs of water in this scenario is because this peptide is actually taken daily, and this is 1 month supply. So 3 mLs breaks down to just 0.1 or 10 units every single day. So it makes it really, really easy for dosing. However, if you wanted to mix a lesser amount and inject less per day, contact your provider and get the exact dosing for it. But for purposes of this, and for most of our patients, we're going to be recommending 3 mLs of water mixed into the peptide vial for simple dosing.